Hi guys, I'm glad to be here today. I'm Associate Director for International Programs in the Herbert Wertheim College of Medicine. And I actually have a PhD in International Relations from FIU from a number of years ago. And I've worked in student affairs over many years at Georgetown University, American University, University of South Carolina. But I chose this particular article today and chose to be here with you guys today to talk about, I guess what we could call the medical brain drain. And just wanted to have a conversation with you about this particular article and this particular issue. And so as I mentioned, I'm Associate Director for International Programs in the College of Medicine. And what I'm doing in this position is I'm setting up fourth year rotations for our students to go for 1 month abroad before they graduate from medical school. And you may have heard in the last couple of weeks that our College of Medicine has received full accreditation from the LCME, which we're very excited about, and that allows our students to match with residency positions. Our first match day here at FIU is on March 15th. And our first commencement for the College of Medicine is on April 29th. And the other aspect of my position is working with international medical students who may want to come here for also a period of about a month, either to do research or to do some kind of clinical observership. So the article really goes to kind of like the crux of the matter. And as you could also see from the article, there's a lot of interest on the part of medical students and physicians to come to the U.S. And one of the things that I like to do is think about, why do we do the things that we do? And think about the greater context that surrounds the work that we all individually do, and here in particular, the office that I work with. So I just want to start out, and you guys will see I'm very much interactive. Please jump in, and I'm hoping that we can have a good conversation. So what struck you about the article as you were reading it? Did anything strike you as you? Mm-hmm.
It was pretty interesting that the United States has more doctors than Canada, Australia, and Britain combined, just because I guess it's the same.
Mm-hmm. Mm-hmm.
They also found like a comparison between American medical students graduating from overseas and coming back here, likewise with the individuals overseas and in other countries trying to come over here and gain residency.
Mm-hmm. Mm-hmm. And that's, so a little bit of background on American medical students going overseas to do their medical education. That's a factor of medical education being so competitive. So as you guys know, we have pretty much a brand new College of Medicine here, which opened its doors in 2009. And even in the first year, we had 3,700 applications. And that was for 43 seats. So that just gives you the idea of the intensity of the competition for spots in medical school. And so as a result, there are institutions abroad, who are working with American medical students and educating them. And then those medical students then take exams, the USMLE, the different steps of the USMLE in order to, be able to be part of kind of like the American medical system and rejoin the system and maybe do a residency here. So, other things that struck you? No? So what are the conditions of medical practice in Zambia? Mm-hmm.
Very poor.
Okay.
When I say poor, I mean that they don't have the right equipment, neither they are prepared as they should be,
Mm-hmm.
and they don't have the right care with their equipment, as meaning the cleaning and the right procedures that should follow from.
Mm-hmm. Mm-hmm. So they don't have the right equipment in many situations. And then even when they do have the equipment, the staff may not be trained on how to use it, right? And if you think about it, if you're a professional and you're trying to help people with regard to their health, can you imagine how frustrating that must be, just even on a personal level? That you know how to help people, but you don't have the equipment or maybe the medicine, you know. So what are some other things about medical practice in Zambia that you learned about in the article?
The fact that their blood bank is run out of blood, you know, that they don't even have resources to help people, even if, even like undertrained staff is better than no staff, so even the doctors that are trained over there realize they have better opportunities over here, so you don't end up with no staff, you know, no staff with the.
Mm-hmm. Mm-hmm.
And it said like calculations like the life expectancy was like 46. Many people with HIV AIDS. Just the general health conditions in Zambia is not like this in the United States.
Mm-hmm.
And then besides that, there's a salary difference between both countries here and Zambia. But at the same time, I mean, their education is funded by the government, so it's kind of a trade-off. I think, you know, we like students from medical school come out with a huge debt, so they're paying that off. But in the case of Zambia, that they won't have like as much of a big of a debt as the U.S. like medical students.
Mm-hmm. Mm-hmm.
So maybe that's why there's something that I'm not quite sure.
Okay.
The economy of the country can be,
Mm-hmm.
which is affecting, like, people cannot evolve if they don't have enough resources. Like as child, some of them might have to go to work, which most of us over here are starting not to, since we have schools.
Mm-hmm.
And,
Mm-hmm.
and education over here is a must, while over there is a choice.
So even though, what I'm hearing you say is that even though the doctors are not well paid in comparison to the United States, they probably are the elite in their country, and they were given opportunities, and you mentioned how medical education, their medical education was paid for, probably even by the Zambian government, I heard you say, right? And that's something important to consider. You know, the cost of medical education, even at a place like FIU, is about in-state tuition and including all the costs and fees and everything is $60,000 a year. So if you're graduating from medical education and didn't have any scholarships, that's a pretty significant amount of debt to, you know, to graduate with. Were you going to say something? No. Okay. No worries. So we touched on a few issues, that the blood bank has no blood, which that just seems like a basic, you know, if somebody needs a blood transfusion, that's just not even in the realm of possibility. The hospital is understaffed, right? And I think you've alluded to that in maybe different ways. And I think another factor that was mentioned is that the lab is unreliable. So even if there is a lab, you know, you could do tests there, but then you're not getting the results that you feel you should be getting. What's the result of these conditions, not just for medical practice, but then also just the conditions of health in Zambia? Like what is happening in Zambia that maybe we don't see quite as much here? High mortality rate. So as a physician, you know, seeing people die is something that you're going to see all the time. And what's our I'm going to call him our protagonist, I guess. Desai is how I would pronounce his name, but I'm not 100% sure. I don't want to assume that I know how to pronounce that correctly. But our main protagonist, what What is his perspective on the death of his patients?
That he feels miserable and he's like frustrated because he can only do so much as one person. And there is even a part of the passage where it says that he's giving out money to take lab work to private companies and have the results done because the lab is just unreliable. So that like frustrates him, and I guess that's what influences him to come to the United States.
So we touched a little bit on the health situation in Zambia. And you mentioned the life expectancy is 46. What's our life expectancy in the United States of America?
Like 78.
It's like 78, around there. So that's, you know, we live 30 years longer in this country than citizens of Zambia do. More than 1 in 10 children die before the age of 5. And we also have to mention the prevalence of HIV Aids. There are 14 million individuals in Zambia living with HIV or AIDS. One of the most striking, I guess, sentences to me regarding the article was something that I'm going to call him Desai said. We were pretending to be doctors. What does that mean?
I interpret it as they couldn't do their job the way they wanted to. They could not save people's lives because of their situation. So he feels they were not fulfilling their job because they did not have the capacity to do so.
And how frustrating.
Yeah.
I think how frustrating that it is the case, and then how frustrating that you have to admit it, you know? So what did Desai do in the article? What does he choose to do? Leave the country? Okay. And where does he go? Okay. To where? New York, okay. I think he's in New Jersey, but same general area, yeah. And how is his salary compared to what it was in Zambia? Mm-hmm. Mm-hmm.
It just shows, from my interpretation, also that it's not just because of the globalized economy that they tend to migrate to places with better pay, but as well as frustration. You know, that might be a misinterpretation by most people, is that it's just for a better salary, but there's a lot of frustration behind it as well. I believe he wanted to go back, from what I understood in the article, just to improve the quality of living.
But do you think it'll be easy for him to go back?
Absolutely not. He does not have the resources, and he's not well equipped. He's possibly more knowledgeable on how to approach with different patterns, but under-equipped, definitely. Not set up for success. So.
Mm-hmm. And what else has changed? I don't think I've heard a voice from over here, so I'm going to need a voice to come in from this side of the room.
Actually, I have a question.
Okay.
You said there was 14 million people that are living with HIV.
Mm-hmm.
It says here on that it's more than 1 million of the 14 million.
Oh, okay. So maybe I misread that when I was working on the
And
article.
I was like, how many people do they have? Yeah.
So maybe the total population of Zambia might be 14, and that would make sense. So would you return to Zambia in his situation?
It all depends. It just, I don't know what the decision, you know, it all depends on I live in a country where, I mean, I'm from Honduras, which
Mhm.
they have, you know, we help kids that have HIV and AIDS and things like that, and it's also a poor country. So it all depends on what brings you out of the place, or what are the conditions, whether your family or whether the life, the expectancy is over 46. Maybe he sees that he's gonna die at that age or something.
Mm-hmm. Mm-hmm. And what else has changed for him in his life since he came to the U.S. and? Mm-hmm.
American child, so even if he wanted to go back there, it's going to be very difficult to convince his family, to go back there.
Mm-hmm. Because what a different experience as a child to grow up in the U.S. or in Zambia. Mm-hmm.
Maybe he feels in a way fulfilled because after having studied all that he did, he got to come to America and practice as the way a doctor is supposed to be able to practice, with all the, with the adequate supplies and that kind of thing. And I think that, the article doesn't say this, but I think psychologically that has to have had a positive impact on him.
Mm-hmm.
Because
Mm-hmm.
one of the big problems I see, or I think I see, with this article, in regards to Zambia's conditions, is that, these people will be sick, they'll go to the hospital, and then sometimes there'll be supplies, but there won't be staff. And
Mm-hmm.
sometimes there'll be staff, and it's kind of like a coincidence if they survive.
Mm-hmm.
So then what that does is that psychologically it puts the entire population of that country in a state of somewhat learned helplessness. Like if they get sick, they're like, I don't know if I'm gonna die or not. I'm gonna go to the hospital and see what happens. And he probably brought that back with him from Zambia, but here he was likely able to, how should I say it? Demonstrate to himself what he's capable of doing under the right conditions.
Mm-hmm. Other thoughts? So do you understand the choice that he made for himself?
Yeah, the way I see it is that he wants to live a happier life with his profession, and I think, he's obviously happy now by his child, and I think going back is it's not really going to help him. It's going to be hard for him, and it's like going cold turkey basically, but, I think what he did was good for himself, especially for the profession.
Mm-hmm.
I agree with some of what everybody said. It's good that he put himself in a better position, he's working here in the U.S., but my thing is, what is Zambia left to do? Because a lot of people are turning, their heads to better salary, but then again, these countries are the ones that greatest need.
Mm-hmm.
So my thing is, what is Zambia left to do?
Mm-hmm.
I don't know if any of you guys are familiar with Paul Farmer.
Mm-hmm.
He does work out of Haiti, and he spends time at Brigham Women's Hospital, but it's not as though he turned a cold shoulder. He's still giving back and putting out awareness about Haiti, but as well, he's working here and getting paid here and sending resources over there to help people who are in need. It's one thing to put out, an article and put out education awareness, but then you just can't leave it at that.
So you're uncomfortable. What I'm hearing you say is you're uncomfortable that he's made this choice to come to the U.S. and then he personally, so far, is not reaching back to Zambia, right?
I completely agree with what you said. As a parent, I understand that you want to provide your kid, obviously, with a better living condition. But who's to say he hasn't completely turned a cold shoulder? He could still help out. Or when his family grows up, he could, go back. He grew up in those positions, and he's someone who can make a difference. He has the power to do so. And a lot of people in those places, especially the general population that didn't have a chance to get an education, do not have the power to better themselves. So if you have the power, you should help make a difference.
Mm-hmm.
And I think it goes both ways contributing, because I know FIU, I'm part of FIU Amsterdam, and I went to a Jamaican medical trip. So doing that was a pretty big experience. They don't have the supplies that they need. It's something, not exactly, but
Mm-hmm.
they don't always have the supplies they need. are almost always open. You know, there's always a case for infection. And so cases like that, you know, makes me think that Americans do come out and help out other countries, and I think it goes both ways.
So just to throw out some numbers that were mentioned specifically in the article, kind of going to what you were saying. Zambia has one doctor for every 23,000 people. And in the US, like nationally, we have one doctor for every 416. Okay? That's a pretty dramatic difference between the two. And let's talk about the US for a minute. Does the US have all the doctors that it needs?
No.
Well, according to those statistics, apparently I feel as if that's still too little, as well as maybe some other people in here. You know, it's 1 to, what was it that you said?
416.
416, like my friend said here, it should be half, you know, at least.
Mm-hmm.
That's quite a bit.
I feel from a global standpoint, the U.S. does have enough doctors to be able to help the people that it needs to help, because many of the doctors that we do have are skilled professionals from the most prestigious schools. They're getting education from, compared to other undeveloped countries where they don't have as much resources or skilled professionals on hand to help out.
Mm-hmm. Mm-hmm.
You may kind of cover all the topics.
Okay. So one of the reasons the U.S. estimates, or like, you know, organizations that work in medical education estimate that the U.S. needs an additional 200,000 doctors. And the reason for that, it's like we can't look at one statistic, like one doctor for 416 people. Like in a city like Miami, there are so many doctors. Like whatever specialty you need, whether you need primary care, whatever the case is, there'll be doctors. Where the U.S. is lacking is in rural areas, and there may actually be, you know, areas of Florida, the rural parts of Florida, where where it's hard for individuals to get to a doctor because it may be like 1 or 2 hours away. And so the U.S. actually has an immigration system where foreign doctors, you know, who have gone through the process, the USMLE process, and who've done a U.S. residency, you know, can stay in the United States, but they need to work in rural areas where otherwise there would not be a doctor. So kind of like providing care in areas where there currently is no care, or little care in comparison. And I don't necessarily think that it's anybody's job to decide, okay, rural areas in America, you know, need this versus Zambia needs this, but they are needs. They're both needs. They may not be on the same scale, you know, which is the point that I hear you making. And then, you know, part of what we've talked about is, in the case of this individual, his personal journey, his ability to earn more money, you know, than what he was making before. Tell me a little bit in what you read in the article, what he has friends or colleagues from Zambia, right, who are making different choices from him. Can you tell me a little bit about what those different choices might look like? So one of the examples that was cited, and I do not mean to mispronounce his name, is George Ofori Amanfo, who I guess is from Ghana. And he is in North Carolina. And he's a physician and has a very good life in North Carolina. But he feels a pull to his home country of Ghana. He feels an obligation to go back to Ghana and to help Ghana. So he goes 3 times a year to Ghana and, either trains physicians or, cares for patients, and continues to give back to the country that raised him. And one of Desai's colleagues back in Zambia says, if you left, yeah, it means you have a better life. Yes, you get more money. Yes, but you can't enjoy a meal when you know that your mother is hungry. Does that strike a chord at all? Mm-hmm.
I understand that there's a need and immediate need for active participation in these countries, but from what I've noticed, and pardon my ignorance if I'm not aware that maybe in Europe or other European countries or other nations around the world, if there is no awareness like at the same scale or like level of gravity that there is in this country, a lot of doctors that come from these countries are trying to help out a lot. They're inputting a lot of resources. So it's a two-sided coin in that, yeah, there are some countries, some people that say we need to actively participate more, but I feel like we are among other countries in comparison at least, and yeah, I mean, for instance, in Africa, I understand that between the Arabic, or not Arabic, I'm sorry, but the non-African and the African Legion, or Union, that divide the continent in half, there's a lot of dispute, there's a lot of opposition, as well as in a lot of immigration problems in many European countries, Eastern and Central European countries, from Africa as well. There's a lot of just unrecognized racism going on right now, and that causes a lot of it just decapacitates a lot of countries for the possibility of helping out, So I feel like we're at a good state of just existence with helping, these countries, and I think we are doing quite a bit. I mean, we can't do as much as we wish, but then again, that's a very hard goal to achieve.
Mm-hmm.
So, I mean, we are taking the right steps, I believe.
Okay. Mm-hmm.
Okay, I know it's not a debate or anything, but I kind of agree with him, but then I kind of disagree with him. I think there is much more work that we can be doing just as individuals or global citizens of the world here in the U.S. And I kind of agree with the piece that you read where you can't really eat comfortably knowing that your country is at a point where it needs your help. And so I think like the Zai, I think that he has much more work that he can be doing, but it's just a matter of accepting that opportunity to reach out or even put out awareness or like a fund or something, just to give back. I'm not saying he has to go back 3 times a year like this guy from Ghana, but just open up a fund or something.
Do something.
Yeah.
Okay. Mm-hmm.
I think that when a person, puts or tries to manipulate in a way how another person should live, because like they made a choice of studying medicine, they made a choice of being who they are, then at the end they have their own choice of doing whether they feel from their heart to serve others or how limited they feel. So when we come and we kind of want to push them to do that or say, they should do this, they should do that, and then sometimes, it's like, what are we doing? Because we can say about them, oh yeah, he should do this, he should do that, but what are we doing? So sometimes, we have opinions of what other people should do, and, when it comes down to other countries and helping out and foundations and helping the poor and helping these people that have HIV, but it's like, what are we putting in? So, maybe he doesn't have that compassion, or maybe he's limited or whatever it is. But sometimes it's like, what are we going to do to make that difference? Not what is that other person? We can't control him. So,
Well, I mean, there definitely, in some of the literature on international medical education, there is, and this is a little bit of what you're getting to, there's like an ethical discussion about whether the US should invite foreign physicians in the way that we do. You know, because I understand at some level it's his personal decision. He received an opportunity and he went with the opportunity that was presented to him. So it's a very personal decision, and I think we would all agree that, you know, we all make the decisions that are best for us and for our families, and, you know, to some degree nobody should argue with that.
I'm sorry, I just wanted to touch on the aspect of the article that refers to the looting or theft of these individuals from their home countries. And I think ultimately, as it says here, it's a group of doctors, several of them African, and I can understand the perspective from that side, but it sort of puts the onus on the receiving company, the country with the opportunity, because it's not so much an issue of recruitment as the opportunities that are presented to these individuals by coming here or to a Western country versus staying in their own countries. But I think if you're going to put the responsibility on any government, it needs to be on the Zambian government to then, if they're going to invest in individuals in their country to educate them, then I think that if any law is going to be enacted, if anyone's personal civil rights are going to be affected, it should be the Zambian government doing it to the Zambian recipient of the resource. And to put it on the West, which often happens because it's easy to blame those that have for those that don't have. And I'm not abdicating the responsibility that I've heard presented here, because I think on a personal level, I feel a responsibility to share the blessings that I receive. So I think that I extend that as a nation and as a global citizen. But I don't think we can simply take him or his government off the hook because of the conditions. I can understand his not wanting to return because there has to be a huge sense of futility in it. And he could probably be more productive should he choose to visit, send back, money, and there are other ways that he could cooperate. But I think one of being someone in the medical profession and dealing with the sick, there are times when medicine works contrary to the macro approach within a country, because you have to understand also that in Zambia, a good portion of the country is literally dying of starvation, not of lack of medical attention. The medical attention is secondary to the physical health that comes from not being able to feed themselves. In a country that basically has agriculture but is exporting it. As an IR background, we recognize that that's the problem with many third world countries, that they produce for export, they don't produce for feeding their own people. Zambia is an example of that. So again, it's nice to sit in this beautiful air condition and sort of blame ourselves for the way that others in the world live or fail to live. But there's enough responsibility and fault to go around.
Any thoughts on?
I think I was well put, but like on the spot, but like it is true that that we realize that there's a shortage of doctors and we're doing something about it. Now, can that be said to like other governments that they realize that there's impoverished areas, there's just a very bad doctor to patient ratio, and they should be doing something about it.
Well, and I think part of what you were alluding to, like if you receive a Fulbright to come to the U.S., there's an expectation that you're returning to your home country for at least a period of time, and that's something. Zambia could do something like that for the doctors that it funds, for the medical students that it funds.
I'm from the Guatemala. And we kind of have like a similar like situation, because like our government basically like pays for you to like go away, like depends on your profession, you want to like
ideas to work in the public or the private sector. And that's basically like, I'm giving back to my country in that way. So I do think that it would be a good idea, because it's like, if they don't have that now, I can take the opportunity and say, well, I don't wanna go back to the Virgin Islands, I'm gonna just stay in the US and practice accounting here. But like, in terms of like the bonds and stuff like that, like they kind of like help you to get a job even before you come back. So like they have like certain what's it called, like
Services, maybe?
rules and stuff like that's inside the bond that you are like obligated to do before you like get back. Like let them know like when you're finishing, so that they could start to like look for jobs for you in like whatever sector. So in terms of like doctors or whatever, like it's good because like my brother is studying away to be a doctor as well. So it's like he has to like come back and practice there, and then like after the bond is over, then like you can decide if you want to go stay or go away.
But in the meantime, you've paid your
Yeah.
debt back by
Yeah,
being
exactly. So,
present
like, after
and
your bond is
participating
basically
in.
paid them back basically by working in the public or the private sector. You have a choice after that bond is over to either go or just stay.
And the military, in the US, the military does that with medical education. So you can be on a military scholarship throughout medical school, and the military may pay for a portion or all of your medical education, and then you owe them a certain number of years after that, including a residency in a military hospital. But that's within the US.
I have a question. With agreements like that, with signing a contract for a scholarship, what is to say that you actually do come back? Like, will they really go hunt you down if you decide, okay, well, now that I'm done with my education, I got my piece of paper, I'm gonna fall off the grid and be where I want to be and work where I feel like working, with my degree, without my degree, whatever, but just to remain in the country that is not impoverished or something like that. I mean,
Well, I think
are
it
they gonna
depends
be
on
following you around? Are they gonna-
It depends on the country, but in the U.S., say if you came on a Fulbright or if you come on a J1, you have to either do those 2 years or legally resolve that issue before you can move on to any visa status or anything, So it does have, in the U.S. anyway, it does have an impact on how things play out
You can't just like
for
be,
you.
undocumented.
Well, I mean, I suppose you could choose that, but that might not be that might not be the best.
So you could definitely tell your home government, I know I signed this contract, but I don't want to come back. I think a real big problem would be just that. Once the brain drain begins and they start sending the kids that seem like they might have some promise academically, they send them away and the kids might not want to come back, right? Or after they already have their degree, they just want to leave. In Cuba, there's something similar like that. A doctor is trained and they go to school in Cuba, but when they have their degree, they can choose to go to other countries depending on what the government allows, but they go basically to practice in countries that are more impoverished than Cuba, and they have that choice to return. And for example, my aunt, who just kind of did one of those like fall off the grid things and came to the United States, she cannot practice here. So she's kind of been like reduced to a certain extent, at least financially, and she doesn't get to travel like she does in Cuba. She's just closer to her family. But regardless, like what would you do about a brain drain like that? There's really no choice. It's all up to the individual.
Well, and I think that's part of what we had one comment in the back and then you.
In terms of like, I know like personally for us like in Guatemala, you like once you're like on your 18 or whatever, and like you're seen as like dependent on your parents or whatever. don't come back like at all, they're kind of being a little bit more strict now for us in the Virgin Islands, because like they see that it is happening, that some people are not coming back and like nothing is happening to them. But in terms of like now, like they're trying to like be more strict, because they're like, the person that signed the bond is gonna be responsible for like getting you back in the Virgin Islands, because they will have to like pay back the government.
Mm-hmm.
So like for example, like my mom would have to like pay back the government all of the money that they like gave me to come away and study.
So your mom will make sure that you come back. Hang on one second. We have.
I'm just surprised that for the doctors that are staying there, that are receiving sufficient income through like the Bill and Melinda Gates Foundations, that their research, they're not seeing patients. I'm surprised that the patient is not a variable to the research that they're doing there.
Mm-hmm.
So,
Mm-hmm.
what are they researching if the patients are not part of their
Are not benefiting from it.
right?
Yeah. Yeah. Do you have any solutions to the situation that we've discussed? Any things you think should be put in place? I did want to mention to you a new, this is a U.S. Initiative. It's a joint between the Peace Corps and a private organization, and it's called the Global Health Service Corps. And the idea is to get practicing physicians to go spend a year in Africa. And I don't know how many of you are familiar with the Peace Corps, but the whole idea behind the Peace Corps is your costs are met, while you're in the Peace Corps, and then you get a small stipend when you leave. What the Global Health Service Corps is doing that could attract either young physicians or middle-aged physicians, whatever the case may be, is that they have partnered with a private entity that is providing $30,000 of loan reimbursement per year. So if you go, you've graduated from a U.S. medical school, you've done your residency, you could potentially go somewhere in Africa. They're focusing exclusively on Africa right now. And you could serve there for a year, and while you're there, you're not making obviously a lot of money, but at the end of that year, you will get $30,000 cut from the loan burden that we discussed earlier. So that's an interesting, partnership, because it's obviously not just Africans or, individuals of African descent who might choose to do this, but it might be others. And it's for a year, which is not a super long time, but it's also not a super short time. Because I think, and it was alluded to, you hear a lot about medical mission trips, but those trips are very short, and you can only do so much, in 1 week, 2 weeks, 3 weeks. But if you're on the ground for a whole year, and really can learn the culture and possibly the language, then there's a way, to be more present and to be more involved and to teach others also while you're there. Part of the idea is to be a presence and to teach physicians in the country while continuing to, to practice as a physician during that year.
I just wanted to add on, I agree with what he was saying, how, it is also the responsibility to hold the government accountable as well. And I think that there are a lot of people, in Africa who would want to get education or who want to go to school, who want to study, but they don't actually have the resources to study. So it's not as though they're just sitting there like, oh, I'm getting sick or I'm not eating. It's not that they don't want to help themselves, they just can't pull themselves up by their own bootstraps.
Mm-hmm. Mm-hmm. Any final thoughts on the article?
Just a question about what you were mentioning before. So there's a government program to kind of incentivize doctors with the American educational background to go specifically to Africa. What about doctors receiving the same incentive, even if they're from a different educational background in the medical field?
Well, that would be, I mean, that would be to contact, you know, I would encourage that person to contact it's called the Global Health Service Corps. They are, I don't know if they're still recruiting, but I know they were recruiting for their first class, which is starting in July. So I don't know what the requirements specifically are, you know, if you have to be an American citizen or what the requirements are.
I mean, if the degree is not American.
Well, in medical education, the degree is one aspect, but then you have to be board certified and board eligible. So you have to go through the USMLE process. But I'm not sure how the Global Health Service Corps is working, you know, if they are working with individuals who have not gone through that process. But it's worth checking out. If you check it out on Google, type in Global Health Service Corps, and you can get the name of a contact. Okay? Other thoughts? Other questions? I want to thank you for being here today. I hope you've enjoyed this conversation and the article. And I may see you at another Tuesday Times Roundtable.